Hello, welcome to my YouTube channel. I am Dr. Hassan. So today I'm here with a series of videos on recalls of Mrcem primary exams. So it would be useful for those candidates who are going to appear in Mrcem primary exam in October 2025 or in upcoming years. So I have recently cleared my Mrcem primary exams in May 2025. So I would like to advise few things regarding preparation. You should have enough time for this exam, and you should not appear without any proper preparation for this exam, as it is quite expensive and it is just twice in a year. So make sure that your preparation is well enough before appearing in this exam. So this would be my first video on recalls. First of all, I would make videos on MRChem primary May 2025, and then I will make other videos regarding the previous recalls as well. So let's start. The exam is quite tricky, but here is just I'm going to discuss the important topics and the simple MCQs in simple form that you can get go through the topic as well. Okay, so all of the MCQs were like in clinical form, and some were like in simple and straight MCQs. So the first is, you can see on your screen, that diacritic notch, which is closure of aortic valve. So it was simple MCQ, like they ask about the diacritic notch. When will it appear? There are four or five MCQ options, in which the correct answer is closure of aortic valve. Okay, it is from physiology part in cardiology. So the second is from anatomy part, which is aortic opening um, location. That is the level at which aortic opening is present, which is simple, and it is T12 level of vertebra. Okay, so there was other option. There was other MCQ, that is MCQ number 3, which is you can see that serosa external layer. This MCQ was quite clinical. There was a patient who came with some external injury, and he got some injury on his abdomen, and the sharp knife which pierced his abdomen. And then there was option like which part is the external part of the intestine. So they mentioned that mucosa and other options as well. The external most part is serosa of intestine. Okay, so serosa, and this was like came as clinical scenario. There was another MCQ number 4. This is just like there was a carcinoma in head of pancreas. So on CT, which other structure is just adjacent to the head of pancreas? There's this duodenum. Okay, the duodenum is the second part of duodenum is just adjacent with the head of pancreas. MCQ number 5, superior mesenteric artery. It was simple that which artery is giving supply to the ascending colon, that is superior mesenteric artery. Okay, and the MCQ number 6 is regarding the iron absorption. They asked about the iron absorption in the part of intestine. So there are a lot of options like duodenum, ileum, colon, and etc. So the option is just duodenum. Okay. MCQ number 7. This is also was like were confusing regarding the cells inside of stomach. So which cell destruction cause pernicious anemia? That is parietal cell. Okay, because parietal cell release intrinsic factor. So deficiency of intrinsic factor leads to pernicious anemia. So MCQ number 8 is decreased gastric emptying. There are 2 or 3 MCQs on this. So there were different hormones mentioned in the options, and the secretin is the correct answer regarding the decreased gastric emptying. Secretin, decreased gastric emptying. Okay, and the MCQ number 9, which you can see that succinylmethanium. There are other side effects and adverse effect of like succinylmethanium were there. So hyperkalemia is the correct answer. Succinylmethanium cause hyperkalemia. Okay, and the MCQ number 11 is aortic wall auscultation, about the aortic wall auscultation. This you can get in anatomy section in thorax part. Okay, so the second right intercostal space in which we use to auscultate aortic wall. Okay, so this is also important, and you must have to study the topics which the MCQs uh, came from. Okay, so another MCQ which is from endocrinology. This was simple MCQ, and they just ask about the posterior pituitary gland release oxytocin hormone. Okay, and from MCQ number 13 to 16. Okay, apart from these MCQ, there were other MCQs as well, around 6 to 7 MCQs, which were come from renal physiology. And among renal physiology, there were block of MCQs from the nephron part. Okay, so you will have to study very well in the renal physiology and the all of the nephron part. Okay, so these three MCQs just like are similar, and each were come in separate MCQs. So the first was like uh, about the channels present on thick ascending column, sorry, thick ascending loop of Henle. So there is sodium, potassium, and chloride co-transporter present in thick ascending limb of nephron. Okay, so there were other options like sodium chloride, sodium potassium channels. So the correct answer is sodium, potassium, and chloride co-transporters is present in on thick ascending loop of Henle. Okay. The MCQ number 14 is just like the loop diuretics acts on which part of nephron. So it's again thick ascending limb, and it inhibit these co-transporters, sodium, potassium, and chloride co-transporter. And another MCQ which is also related to this previous MCQ, like mode of action of loop of diuretics, which is again it inhibits the sodium, potassium, and chloride channels. Okay, and the 16 was again from the renal part. That is, they asked about the thiazide diuretics, which usually act on DCT. The option among other option was like PCT, DCT loop, thick and thin loop of Henle. So correct answer is DCT, and it block sodium potassium channel in DCT. Okay, so there was another MCQ which regarding mode of action of GTN. So there are other options as well. The correct answer is decreased TPR and venous return. So preload will be decreased. Okay, so you will have to read this as well, and it is in cardiology, cardio in physiology. So other another MCQ number 19, which is related to again acidic chyme in duodenum, which delayed gastric emptying. They just mentioned that what will be delayed in gastric emptying, and there are other options as well. So the correct answer is acidic chyme in first part of duodenum. Okay, this is first part of duodenum. When acidic chyme passes from stomach to first part of duodenum, it delayed gastric emptying. So this was quite tricky MCQ. So you will have to you have to study quite deeply in the chapter. So the 20 and the last MCQ for today's session is regarding Neisseria meningitis. They just ask about the route of transmission. So there were fecal-oral route, airborne, or droplet. All offer in the options. So quite of the doctors were confusing regarding airborne and droplet. So the correct answer is droplet. So Neisseria meningitis transmitted through droplets, not airborne. Okay, so for this for today, this is our video. So hopefully you will like it, and I would like to again advise you to thoroughly study thoroughly before appearing in your exams. So I will make other parts of the MCQs as well. So stay tuned with me. Thank you for watching this video.